Now, on September 1st, Ontario Health, in collaboration with partners in Alberta and British Columbia, which will be supported by funding from the Canadian Agency for Drugs and Technologies in Health, CADTH, will launch the Canadian Cancer Real-World Evaluation Platform. So if you're not thinking about this or haven't planned for this, then it's time that you start thinking about this, because especially if you have products that are listed, or if you're trying to get your products reimbursed, or you're coming to launch with an oncology drug. Now, the Canadian Cancer Real World Evaluation Program and Platform is going to be a core network partner supporting CADTH's post-market drug evaluation, evidence generation network. And so what they're doing in order to manage the high costs of drugs in the context of a post-pandemic scarcity reality is that now they're going to be putting these systems in place, and they could actually be very bold with their decision making, because as you know, we don't have enough taxpayers probably to sustain this level of costs over time. And so difficult decisions are going to have to be made. And so a strategy is required to meet the customer halfway in between and see what you can do based on corporate social responsibility and an economics for the common good model to meet their needs in this situation of scarcity and uncertainty right now in pandemics. So this group is going to be developing policy development and the provision of advice to the different ministries for decision making, as well as strategic and operational planning. Now, the managers in charge of this, or the payers, will be responsible for supporting continuous quality improvement and efficiencies in the provincial drug reimbursements programs processes, and proactively defining and identifying issues that are related to its programs and its mandate. And so this is why, if you are not awake at the wheel and planning because you're overly entitled or optimistic, then you may actually get the rug pulled from underneath you. So having strategists on your team and negotiators, but people that have a payer-centric perspective on sustainability, uncertainty, and an economics for the common good sort of state of mind or mindset is really critical. And so the CCRE program is going to oversee the real-world evidence projects and address the questions that are posed or inquired about by federal, provincial, and territorial decision makers in Canada based on post-market drug safety and effectiveness in oncology. The platform will bring timely evidence to decision makers, enhancing the use of data and post-market evidence to inform decision making in the future in an efficient and responsive way to manage the costs of these oncology drugs and of the cancer prevalence rates and incidence rates that are increasing. Now, what's important to know is that this will include also designing and conducting real-world utilization, effectiveness, and safety studies with patient-level data using provincial administrative databases across the platform. And so they have the data to do this kind of analysis, this kind of risk assessment, and risk mitigation programs put in place to sustain the healthcare system as we increase the number of cancer cases because of the pandemic. Even just the fact that people have developed a lot of addictions has led to increases in liver cancer, among other cancers. Now, the accountability is for the establishment of operations in the Ontario Health Office for the Canadian Cancer Real-World Evaluation Core Platform Team. And this will help generate the real-world evidence that is required to answer the key questions for payers on cancer-related queries from healthcare decision makers across Canada. And so this will also serve as probably with the best practices of sharing with Health Technology Assessment International, likely involve also sharing the information with global operations. And so the risks here when one payer is doing this is that the information then can be leveraged in other markets. And so this implementation plan, which includes policies and procedures and an evaluation strategy, will be done in collaboration with CADIT, as well as some of the other provinces like Alberta and also BC, which happen to be some of the highest cost payers right now for oncology drugs based on how our demographics are set out. An important point also that is not included normally from what I had seen, and because I was actually writing these policy papers and I had a foundation since 2014, so when I wasn't working, I was lobbying for patients' access to essential medicines, gainful employment, equity, metrics as well, and to help people that had any chronic conditions or other conditions to survive. And so I was able to look into a lot of the equity issues, the bioethical issues around the rising costs of medicines, how we can manage them, but also how we can build value moving forward. Not just take value in terms of getting a listing and then, oh, okay, I have the listing, so now I can be optimistic and think nothing's going to happen and sort of sleep at the wheel. That's not a good strategy in access in a post-pandemic reality when we do not have the amount of taxpayers required to meet the rising costs of drugs and the rising costs of diseases. But specifically in oncology and in cancer, that is essential because we have to have a way of meeting the customer and the payer halfway, the government's halfway, in some shape or form. And I find that also if we have the perspective that the payer is wrong and that they're not doing the right thing, then that perspective of negativity right off the bat is going to create a blind spot and make it impossible for anyone in market access or reimbursement or pricing to start brainstorming on solutions for innovation to help the customer and the payer. Now, what's going to be important here is understanding that there will be improvement in the quality and operations of how they do this and analyze the key issues and the risks that are key risks moving forward in terms of sustainability and uncertainty. So I wanted to just give you a heads up on that because this is key information for planning. If you have any cancer drugs or cancer therapies and knowing what your customer is faced with in terms of challenges and trying to meet them in a reasonable way so that we increase the affordability of our healthcare system as well as our drug and our device costs for managing oncology is pivotal. And those who actually are proactive at getting into the mind space and understanding with empathy the decision makers, how they make decisions, what their risks are, what they need, how we can help them, are really going to be the companies and the specific leaders in this space that will have a market leadership position moving forward. So thank you for joining me. I'll probably discuss a few more things on market leadership associated with market access and pharmaceutical or healthcare costs that are rising and how we can contain those costs versus inflate them and blow them up without providing the necessary value to justify our products and the spend over time.